Welcome back. The company on our radar is Dr. Agarwal's Eye Hospital. Reported a decent set of third quarter numbers. Revenue and profit after tax came in strong. Adil Agarwal, who's the CEO at Dr. Agarwal's Healthcare, now joins in. Adil, thanks a lot for joining in. Remember, in the previous conversations, you would say that H2 is typically stronger for you than the first half of this year. And that's reflective in the run rate that you've posted as well. The third quarter, your revenues grew at 25%. So what we want to understand is that from a first 9 month standpoint, a 27% revenue growth that you've posted, where does it stand at the end of this year? And with the kind of hospital outlook that you have, additions emerging, turning into mature, what's your revenue growth outlook for the next financial year as well?
Hi, firstly, thank you for having me here with you. If you see our 9 month financial performance, our top line stood at 1,281 crores, signifying north of 25% growth year on year. Most of this growth has come from our mature centers. We also added 42 new facilities over the course of the 9 months. In the quarter 3 alone, we have added 12 new centers. Our new center addition for the next quarter, which is Q4, we'll be looking at adding about 8 to 10 facilities. Our belief is that we will end the year at around the similar growth which we have shown over the last 9 months. And we believe going forward into the next coming years, based on our current growth rate, we should be able to maintain similar growth rates as we go forward into the next couple of years.
Okay, all right. Hi, Adil, and thanks a lot for joining in. So 25% odd should be the growth rate. Is that correct?
25% for Q4, yes, we believe. We believe that this will be approximately the range we will end at over the course of the next 12 months.
Okay, all right. What about how does the mix look then? If you could tell us, because international business, I think, was roughly around 13% earlier, low teens. That's come down to around 10%. On an ideal basis, how much would that international business constitute as a percentage of your total revenues?
So if you see in terms of new center additions, March 2024, we were at 180 centers, out of which 165 were in India, 15 hospitals were in Africa. In the last 9 months, out of the 42 new centers that we have added, 41 centers are in India and only 1 center has been added in Africa. That contribution from Africa over the last 9 months has come down to about 10.1%. And we believe that the contribution from Africa will steadily decline given the kind of growth opportunities we're seeing in India. Also, the kind of new center additions we are looking at adding over the next 12 to 18 months across the rest of the country, we believe the contribution from Africa will steadily come down.
That opens up to a two-part question, Adil. One is that over the next 9 to 12 months, what is your store addition plan? Secondly, are you looking at some point hiving off or exiting the Africa business? Because the debt on your books is high and you do have a clear plan of becoming debt-free. So if you could give us, an outlook on this, the number of stores that you plan to open over the next 9 to 12 months, what happens to the Africa business? What's the debt on your books? And when do you become debt-free?
So if you see our current network, most of our centers are located in our core states, which are Tamil Nadu, Karnataka, Andhra, Telangana, and Maharashtra. We actually have 26 hospitals across Maharashtra. In the next couple of years, we believe 70 to 75% of our new center expansion will come across these 5 states. And the remaining 20 to 25% will come across the remaining non-core states. Our endeavor is to keep up a similar growth rate of new center additions that we have done in the year FY 2025 over the next couple of years. And from those, we will be looking at only adding about 1 to 2 centers across the African continent.
And
now,
are you
In terms of what is happening with the Africa business, we have set up some quality facilities across countries such as Kenya, Tanzania, Mozambique. We are continuing to do good work. We have a first mover advantage in many of these countries. We have quality practitioners working across these facilities, and we will continue to operate these facilities. We have no plans of having off the Africa business because if you see some of the kind of clinical work that we have been doing, it is state of the art. And in many of the countries, you are the only private eye hospital located across some of these countries, right? So we believe we'll continue to manage these facilities and continue to grow. It does not require any external capital from the Indian entity. These entities are well managed from a financial standpoint. Their return profile also are similar to what is happening in India as well. So we believe we'll continue to run these African operations as well.
Adil, what is the absolute debt number that you have currently, and where is it headed?
So our total debt right now is about 360 crores, and we will be paring down around 195 crores of that. So we'll be around 150, 155 crores by the end of this financial year.
And how much do you plan to spend on marketing every year? Because we saw the Sachin Tendulkar, Glenn McGrath ad. Took us back to our childhood, the shoulder before wicket thing. But from a financial standpoint, how much do you intend to spend on advertising and branding every year?
So firstly, we are very privileged to have partnered with Mr. Sachin Tendulkar, as who became our brand ambassador this year. If you see, our marketing expenses as a percentage of revenue are around the 2.8 to 3% range, and we believe that will continue over the next year at least. We spent about close to 50 crores in marketing expenses. Marketing is important, and we will see this percentage stabilize at around 2.8 to 3% over the next couple of years.
Best innings of Sachin was when? Which was your favorite innings? Which was your favorite innings of Sachin?
My favorite innings of Sachin, was the 241 which he scored in 2003 in Sydney. That was a test of significant character. Given a lot of news we're hearing about what happened in Australia over the winter, I think that was a standout innings from my perspective.
And it was done without wearing glasses. So obviously speaking about his eyewear as well.
Yours, Mangalam?
Mine has to be the 98 versus Pakistan in 2003, Centurion.
I think I like the innings he played in the Middle East. The Sharjah. That to me was something special. But thanks a lot, Adil, for joining in. We went a little bit off tangent, but good having you on the show. Thanks a lot for joining in.
Thank you very much for having me.
For the time being, we'll slip into a short break. Come back, we'll continue to focus on the markets and stocks.